Hi, I am Coretta Jennerette, and I will be talking about EMBRACE, Traveling with Sickle Cell. The work being presented is supported by EMBRACE, a project with the overall goal to improve access to high-quality care for individuals living with sickle cell disease in the southeastern United States. There are some additional goals, as you see, about providing evidence-based, guideline-based care, technology support, and individual and family engagement. Travel with Sickle Cell is a part of the EMBRACE community engagement work. EMBRACE engagement seeks to adhere to the sickle cell community motto of nothing for us without us. Dr. Lakia Bailey and I collaborated on the work being presented today. So I will provide some background and significance, share some focus group results, and present an example travel letter. Try to say that twice. First, we know there are challenges related to traveling with sickle cell disease. The challenges may be different based on the length of travel, the mode of travel, and destination, but they're all pertinent things that need to be considered, such as acute sickle cell pain, infections, venous thromboembolism, also known as VTE or blood clots, limited or different access to medical care, and hypoxemia or low oxygen level. I'll cover a few of these in a little more detail. So venous thromboembolism or VTE, also known as blood clots. To decrease the potential of having blood clots while traveling, there's a need for frequent ambulation or getting up and walking around, utilizing calf muscle exercises. If you're traveling on a plane, trying to sit on the aisle seat if possible. And then, of course, if you plan on being engaged in air travel for more than 6 hours, you probably would be best served by communicating with your healthcare provider for some additional things that you might be able to do. If acute sickle cell pain occurs, there's some things that might better position an individual with sickle cell disease. Having a travel letter that we're going to discuss later that includes a treatment plan, having enough pain medication, especially the opioids, to last the duration of the trip, using some prevention measures to include trying to avoid dehydration, avoiding alcohol consumption, and minimizing any exposure to extreme temperatures. And then, of course, having a plan for treatment in place. From the healthcare provider perspective, there is a need, depending on your specific position, to consult your healthcare provider to determine if any of the following need to be done in advance or scheduled and coordinated during your travel, such as simple blood transfusions or red cell exchange. This is usually in the case with people with severe disease, or if it's a longer trip and there's limited access to sickle cell care. If there's a need to arrange for oxygen during your flight, based on your need for oxygen, if you have a baseline hypoxemia, or depending on where you're flying. If there's a need to refer you to a local sickle cell program, if there's a need to provide information for an intake visit, if you have a longer visit, or if there's just some recommendation that your provider actually have direct communication with a provider in the place that you're visiting. So, in addition to some of this background information, Dr. Lakia Bailey and I also conducted a focus group. Now I've gotten interrupted by my 6-year-old showing me her ant farm collection. So there's that.
Why?
From the healthcare provider From the healthcare provider perspective, there are also times when an individual with sickle cell may need to do some things in advance of travel or plan for them during travel. For example, you may need to consult your healthcare provider to determine the need for or to arrange for a simple transfusion or a red cell exchange, to see if you if you're going on a longer trip or there's limited care in your area, or if you actually have what would be considered a more severe form of the disease. You may need to make plans to have oxygen available on your flight, depending on the length of your flight or where you're flying. If you have a baseline hypoxemia or low oxygen level, and there may be the need to have a referral done to a sickle cell program in the area that you're visiting, either for an intake or just to have some direct communication with the provider in that area, to be preemptive, to make sure that those lines of communication are open just in case you need something. So in addition to this information, Dr. Bailey and I also conducted a focus group because we wanted to hear from experts. So I'm going to go over just a little bit about our participants and the themes that came out of the focus group, the lived experience. So on July 25th, at the sixth annual Sickle Cell Patient and Family Education Symposium, we had the opportunity to talk to 14 individuals. Several of them were either caregivers and parents, and then the bulk of them were patient advocates, individuals actually living with sickle cell disease. They represented EMBRACE states of Tennessee, North Carolina, and Georgia, and many had traveled to the conference either by car, air, or a couple by bus. So what did they tell us about traveling with sickle cell disease? The first and most talked about theme was preparation. Preparation for travel is very important. Individuals with sickle cell disease must prepare for travel. Preparation includes pre-medication, compression socks, stretching, hydrating, mindfulness activities for calming, and making sure that you have medication or a plan to acquire medication at the destination. They stressed, know your pharmacy. Know if you can get medications in a different area than the one you live in from the same pharmacy. Is the access still the same? In the same theme of talking about preparation, not only does the patient have to be prepared, but in the case where a caregiver is accompanying the patient, the caregiver also has to be prepared. Trial and error is something that individuals may do, but it can lead to poor outcomes. It's important to prepare and go. They stress that individuals with sickle cell can do whatever they want to do with adequate preparation. So preparation, preparation, preparation. And they stress that this includes international travel. Even though there may be some restrictions due to fear, and that can be problematic. Some other important themes. Communication about travel is important. It's very important to communicate with your healthcare provider about planned travel. Travel letters, which I've mentioned before and will show you an example of later, from your healthcare provider can help support aspects of your care and provide a succinct health history. And also know where healthcare providers are located in your travel destination. The next theme, eustress and distress. Eustress is good stress, but good stress, just like bad stress, which is distress, can both lead to crises. Consider the importance of balance and knowing your body. Things to avoid. Try not to travel while you're in pain. We know this may be unavoidable, but it's something you could try to avoid. And don't travel with individuals who are not supportive and not empathetic to the challenges of sickle cell disease. For example, when I talked earlier about the need to ambulate, to make sure you're hydrated, all those things, it may obviously require, if you're especially traveling by car, that you stop more often than someone who doesn't have sickle cell would like to stop. So if you're traveling with someone who cannot accommodate your need to stop more often, then it may be inadvisable to travel with that person if they're not supportive and empathetic. And then lastly, the fact that stakeholders need to do a better job in educating individuals with sickle cell about travel. Next, I want to show you a sample letter. So this is based on a template that could be provided to you and your healthcare provider in order for you to share some important information about what living with sickle cell is and how to contact the provider. It goes over areas such as what to do if you have a fever greater than 101, what acute chest, difficulty breathing, and hypoxemia, what should be done. If you're in acute pain that's not relieved by Tylenol, ibuprofen, and narcotics, oral fluids, and bed rest. What if you have marked lethargy and pallor, meaning that you're very have no energy and your color has changed? What if you have neurological symptoms, like symptoms of a stroke with some seizures or weakness, those type things? So this gives the provider that may not be familiar with you some information about what to do, as well as some of your baseline information, your baseline hemoglobin, your white count, are you on hydroxyurea, and your baseline oxygen saturation. So if you're in an area, being seen by a provider that's not familiar with you and may not be even be familiar with sickle cell, this travel letter provides some basic information. And know that this template will be provided on the website. So we would like to thank you and acknowledge the individuals who participated in the focus group and some of the content that was provided by Dr. J.J. Strauss. Thank you once again, and we are now available to answer any questions.